Yeah, lovely. Good afternoon, everyone. Thank you so much for joining us after what I know was a really delicious lunch. So it's really hard to be lured away from all that lovely food, isn't it? And nice to catch up with people after such a strange 2 years. But thank you so much for inviting me to come and talk today. It's lovely to be able to talk about our project, Voices of COVID, in a setting where so many of you had direct experience of the pandemic through primary care. And I think the conference theme of transitions fits really well because our project has been capturing COVID as it unfolds. So obviously sort of through the various sort of phases and the waves and things. So transitions, I think, really sort of is a nice way of thinking about what the last 2 years have been like. So I'm going to give you a brief overview of how the project came about, talk to you about what we've been doing, and then give you some examples of the sort of material that we're capturing and the value of that in terms of developing policy and practice as we move forwards. So, in 2017, with support from the National Lottery Heritage Fund, we began a UK-wide oral history programme. So we worked in 10 localities across the UK, including Scotland, Wales and Northern Ireland. And we worked with a volunteer model. So in each locality, we recruited groups of volunteers and we trained them in oral history. And for the most part, they were the people that went out and did the interviews for the archive. And in terms of the people that we interviewed, it was really a very broad brush approach. So it was across patients, NHS staff, communities, charities. Everyone in the UK really has got a story to say about the NHS if they choose to do so. So the impetus for the project really came from my frustration as a historian working on the history of healthcare and the NHS. Since 1948 in the UK, the NHS has been a unifying factor across our human experiences of birth, work, disease, and ultimately death. It's also been the largest employer with a hugely diverse workforce since the 1960s. And within months of its creation, it had developed a profile on the international stage and it was recognised as a really exemplar of humanitarianism. So from a historical point of view, the NHS gives us the most wonderful frame to think about the history of Britain in the post-war period from all sorts of angles. So from the changes to technology, the changes in our social cultures, the changes in faith and spirituality, changes in food, architecture, building, you name it, you will be able to find some aspect of it reflected in NHS history. But the sources that we had for exploring history from those sorts of perspectives were really limited. The voices in the historical archive were mainly decision makers, white, usually male, and there were so many missing voices from communities and people talking about perspectives that we just didn't have on record. So really, the NHS at 70 project was a response to create a new archive of sources to give us a new way of thinking and working historically about the NHS. Through the project, we've received enormous support from stakeholders. So like the college, for example, has been a supporter from the early time. And now we're working with the later careers and retired members group to do a set of interviews with them so that we capture those really important perspectives of general practice and primary care right from the sort of 60s through to the present. One of the USPs of the project has been the involvement of our volunteers. They have been the people that have brought diverse networks, connections, and really given us the opportunity to create an archive that is much broader and much more interesting than an academic team alone could have achieved. So in March 2020, we were coming to the end of the interview collection. We had almost 1,000 interviews. We were developing an exhibition and we're about to tour the UK with it. But as you don't need telling, COVID happened, so we had to suspend our face-to-face interviewing and regroup in terms of what our response would be. So very rapidly, the spread and the scale of the pandemic convinced us that it was going to be the most extraordinary moment in the longer history of the NHS. And we felt really compelled to do what we could to try and capture it as it unfolded. We also wanted to maintain the social connections that the project had forged with our volunteers, with our interviewees, with all the different networks and organisations that we'd been collaborating with. And so it was actually relatively straightforward to shift the focus of the programme from the longer history of the NHS to specifically capturing COVID. And the other value of working with our communities in that early period was it really helped us with the sense checking. So, was it ethically appropriate to ask people working on the front line if they wanted to contribute an interview? How did we manage the sort of time constraints of people who wanted to be involved but obviously had other commitments? And it was the most extraordinary privilege, really, to be in the position of being able to capture the unfolding of the pandemic from that early moment. And as you'll see from the slide, we managed to do the first COVID-focused interview within 4 days of the first national lockdown. And I think on reflection, 2 years on, one of the striking aspects of that early period was the shared sense of social purpose that everybody involved felt about the work. So our interviewees and our interviewers alike were all convinced that this was something that was important, that needed to be done, and we needed to do our best to capture it. So many people volunteered in different ways. One of our GPs in Manchester didn't have time to take on any interviewing, but she did support the drop-in group that we ran for our interviewers, so that if any of them had been affected by listening to difficult stories or needed support in any way, she was there as a backup for them. We'd already been in discussions with the British Library before the pandemic about depositing the NHS at 70 collection with them, because that way we would secure a permanent sort of home for the collection for the long term. So we agreed to put in a joint bid to the UKRI COVID urgency call to extend the NHS 70 work into COVID and for the collection to be transferred to the British Library, where it will be a permanent resource. And we were very lucky to secure funding for that in July 2020. So that really gives you an example of the sort of data that we're collecting, because totally by chance we've been able to develop a data set that has got pre-COVID interviews, COVID interviews done during the sort of worst waves, and then now as the pandemic is moving to a different phase. And that's the sort of thing we simply couldn't have anticipated at the start. And that will be one of the unique factors of the archive, that we will be able to do really, in-depth comparisons between what the attitudes and views were about the NHS, how people were thinking about their health, what staff experiences were before the pandemic, and then actually what the impact and the consequences of the pandemic have been for them. So I hope from this slide you really get a sense of some of the people that we are capturing. So, for example, in the slide on the left-hand side, Caroline Costa suffered very badly from COVID in the first wave and ended up with sepsis that led her to lose her hands and her feet. So she's quite an extraordinary story of resilience in terms of recovering after COVID. She's now changed from her career as a teacher and is touring schools with a therapy dog, talking to children about mental health aspects. The gentleman at the top middle of the screen is Nick Hart, who's a consultant at Guy's and Thomas's and treated Boris Johnson when he was there in April 2020. Clarissa Velasco, at the bottom of the screen in the middle, is a nurse from the Philippines, and she only arrived to work in the NHS in November 2019 and was redeployed to work in ICU. And she shared this image as one of the makeshift areas that they'd created to be able to look after more patients. On the top right, the gentleman in the pink shirt is Jonathan Blake. He was one of the first patients in the UK to be diagnosed with HIV and AIDS in the 1980s. And the final gentleman on the bottom right is a GP from Manchester, Haider Ali, who's been very active in working to promote the vaccination programme and link it to local mosques and places of worship so that those communities will get a good take-up. I'm now going to show you a very short film which we've developed as part of a film premiere that we're showing at the 23rd of March. So you are actually very lucky. This is the first showing of this little clip, so I hope it's going to work.
I definitely experienced a lot of loneliness. It was not being able to see my friends, not being able to see my partner. Yeah, it was such a hard year, really hard year.
The afternoons are spent sitting in the office, basically ringing families to tell them, I'm really sorry, your loved one is really doing very poorly and I'm very concerned they're going to die. And some days you'll have that conversation 3, 4, 5 times.
You see people who look healthy, who haven't got that much of a history of concomitant conditions, who are younger than yourself and who are dying. It's quite horrific.
I was on pretty heavy drugs. The delirium got progressively more unpleasant. Shrunken heads around the ward. I could see a samurai assassin. It was, just deeply terrifying.
We look after my mother-in-law. She's in a home now. The staff has not been getting their PPE. And I written letters to local MP. And I told them if any one of them falls ill, they will spread it to the home and they'll all die.
A whole range of emotions through the pandemic. A lot of fear because obviously having been ill, my immune system was compromised. Also recognising that we're a family of colour, so if we get it, we're 4 times more likely to die of it.
We've really, in the NHS, come to massively value each other in a way that's created a lot of kindness between staff that clearly wasn't there in quite the same way beforehand.
So I hope from the faces in that brief film clip, that's just given you a sense of the sort of range and depth of the material that we're sort of collecting. And what I want to move on now, excuse me, to share with you are some of the material that we've collected around vaccination. And I think the vaccination programme has been one of the really interesting aspects, which tells us a bit about what it's like capturing history in the present compared to capturing it from a time that's already sort of finished. So, for example, in March 2020, when we began collecting, obviously people were talking about the hope for a vaccine and there were lots of initial initiatives happening, but there was no COVID vaccine. There was no certainty about whether or not one would be developed, how quickly it could be trialled, and what the role rollout would look like. So that's quite different, for example, if we were going back to think about the 1980s, if we were going back now to capture what HIV and AIDS would have been like, we'd already have a timeline. We'd know some of the sort of, historical points and what it might be important to look for or not look for. So really the challenge of the project has been to capture as widely and diversely as possible, because whilst we're capturing it, we don't know what is going to stand out long term as being really important shifts and moments. So in terms of vaccination, we've got a whole range of materials. So we've got people talking about from the early days about their hopes about the vaccine, the trials getting underway, when it first sort of was introduced, policy decisions around vaccination programs, anti-vax demonstrations and views, and lots of reflections on the differences and similarities between COVID vaccination and the big vaccination programs for other epidemics such as smallpox, polio and HIV and AIDS. So the clips that I'm going to play now will just give you a bit of a flavour. And the first one, Sohail Munshi, is a Manchester medic. He was born in Bolton in 1961 to parents who had come from India in the 1960s. And he's now Chief Medical Officer of Manchester Local Care Organisation and also works with the NHS England around vaccines. This clip is from an interview in mid-January when he was talking about the impact that the vaccination programme had had upon staff morale.
I think the thing that's probably kept people going is the sight of the COVID vaccination rollout. And I know in Trafford, for example, we've given about 15,000 vaccinations, similar numbers in Manchester. We're probably giving about 10,000 vaccinations a week at the moment, and we're in a phase of rolling out more and more sites. So I think those numbers will probably triple in the next couple of weeks. And that's, in a slightly odd way, it seems to have brought quite a lot of positivity back into the health and care service, because it requires a lot of teamwork. And I think human beings always respond well when they're asked to work together in a team to support the communities they serve. So lots and lots of volunteers, people sorting out estates, people sorting out the logistics of buildings and how to get vaccination, and doctors and nurses and healthcare assistants and pharmacists all together in one place to give a vaccination at once. Whilst it's very challenging, also seems to be surrounded by real positivity in terms of teamwork.
So again, something that captures very much that sort of early moment. The next clip is also by from one of Sohail's interviews, and that captures the moment that there was a policy change quite soon after the vaccination programme had been launched, and the extension of the gap between the first two vaccines to 3 months, when originally it had been determined to 12. And I think this, again, it exemplifies the value of capturing that moment in time, because what he will express is really some critical questions about the way in which that policy shift affected relationships and trust with patients.
I think I've got mixed feelings. On the one hand, the policy of vaccinating as many people as possible because it will save the maximum number of lives is absolutely right. So I think the move to a wider dosing interval is right. You know, the statistical evidence supports that you'll save more lives if you do that. And I think, you know, the guiding principle of the NHS always has to be to get the maximum benefit for the maximum number of people. The concern about it is twofold, I think. One is we started the vaccination programme and then changed the dosing. That's unbelievably frustrating, because it meant that both hospitals and general practices booked significant numbers of people for their second vaccine at the time you give the first vaccine. And so a lot of those patients had to be cancelled, and there was a lot of angst around that. And I think it's made As a doctor, it made me really uncomfortable, because when you give somebody a vaccine, you have effectively gone through a consent process with them. And part of the consent process is to say, this is your vaccine today. Your second vaccine is in 3 to 4 weeks. And so by changing that, it effectively has made us ethically really unhappy. And then the second thing is just the logistics. Having seen how long it took to cancel thousands of patients and rebook thousands of other patients, I honestly do think that it would have been more effective, fairer and more ethical to just give the second vaccine to those people who are expecting it, and to take a sort of prospective approach and say, but from now on, when we consent people and give the first dose, we'll be consenting them to say you're coming back in 12 weeks. And for me as a doctor, I think that was a poor principle. It breaks trust between doctors and patients. It introduces a feeling amongst many patients that who's setting this agenda? Is it the government or is it the health service? Is what the doctor's telling me today, is that going to change then if national policy changes? And it just harms, the health practitioner to patient relationship, I think, was harmed. And I think public confidence might have been harmed. And personally, I think that was wrong.
So the next clip is from Gail. She's a practice manager who works in Stoke. A very difficult personal situation because her husband was shielding, and she was obviously working, going to and from the practice alternate weeks. So they actually developed sharing the house by dividing it, never being in the same inside space at the same time, and only meeting in the garden for all the months right up till they both had vaccinations. But here she's talking from her perspective as a practice manager and managing that same policy shift to the wider dosing interval.
I think the main issue for us has been not actually doing the vaccinations. The clinics are quite straightforward, although obviously incredibly busy. It's getting the person in front of the vaccinator. We got all these people booked in for a second jab, and then they said cancel those and book another. So they were all booked in, and then we had, I think it was Matt Hancock on New Year's Eve, something like that, sort of said, actually in a response to a question, it wasn't an announcement, to say that was being moved to 12 weeks. So we were in this sort of terrible situation where we were being asked to cancel 975 people and book another 975 people in. And some practices did that and then apparently didn't get the vaccine anyway. They had the vaccine delivery cancelled because it's a push model. It's not on demand. It's just, it gets pushed to you and you have to then sort of react and get people booked in. It's a bit mad, I have to say. Anyway, locally, a couple of primary care networks took the decision to carry on with the second vaccination for that group that had been promised. We've stuck a neck out, and I don't think we're flavour of the week, but we didn't feel morally that we could stop people when we'd said it's really important you come back in 3 weeks, here's the leaflet, and we'd actually rang all these patients to make sure they were coming in. That's how much emphasis we placed on it. And then you're supposed to ring them all back and say, that phone call, some of them that morning, well, it's all changed. I thought, oh, God, no. So we didn't do it. So we might be, I think we've been frowned upon for it, but I'm just in admiration for the people in our primary care network that made that decision. So it was brave of them to do it, but I'm glad they did.
So really interesting perspectives there. And I mean, I do think that sort of material could be really helpful, as we move forward with the vaccination programme and boosters, or, with flu vaccination or whatever other epidemics we might end up with, some reflection on what people's experiences were. I'm going to whiz through the next couple because I know we're a bit short of time.
One of the things that's made it hard at the moment is there's a lot of skepticism because social media, as great as it is for social occasions, you can also use it to make false propaganda and whatnot go across very quickly, unfortunately. So for our patch, our South Asian patients particularly have not really had a big take-up of the vaccine. So again, I've been lucky that I've had the opportunity to take some annual leave, and I've spent the majority of that in discussion with local religious leaders and mosque leaders to see how we can address these issues. And one thing that's happening, hopefully by next week, is we'll be using one of the largest mosques in Manchester to give the vaccine via the mosque itself. And they'll see their, religious leaders there. So hopefully that'll give them some added trust in the jab itself, because I imagine they'll not expect their place of safety, their religious place of safety, I should say, to allow something like that to happen if it wasn't safe.
So I'm afraid I pushed the clip before I'd introduced it, but that was a GP from Manchester, Haider Ali. You saw his image earlier, talking about working very closely with mosques in order to get the vaccination underway with those communities. So I want to leave you with the words of Owen Evans, who leads a project called Future Fathers, which works with disadvantaged young men. And his passion for ensuring that the collection that everybody has pulled together to create is used as widely as possible is echoed by so many of our other voices.
No, I just really hope that the record is utilised and used in the way that it should be. That my voice is one of, I'm sure from what, our brief conversations before we've done the interview, you've managed to reach out to a myriad of people, to a broad church of British society, and I think it's really important, as I said at the beginning, that it doesn't just sit there gathering dust, that it's utilised and turned into tools and resources that help people, whether that be through history lessons in school, whether that be through continued professional development and training of NHS staff and social care staff. It's important that politicians listen and hear these accounts of what happened, and that we don't lose the kind of the knowledge.
So we're just going to give you an opportunity to do your own immediate reflections with these two questions. What would you like to remember? What would you like to forget? People here with us might like to talk to their neighbours. I know people are joining us virtually, and they're going to have the opportunity to do responses on screen. So we'll just give a minute for that, and then we'll move on to Q&A. Okay, it certainly sounds as though those questions have prompted some sort of reflection. Does anybody want to volunteer to share more widely? We've got some roving mics if anyone would like to respond. Yeah.
I was just reflecting that I was in my last year at Manchester University, and I was living in what was mostly council housing, and we were in a sort of student ex-council house. And I was saying, all year we were quite separate, but then actually through this it was the most sense of community I've ever had, because we were all in the garden, it was so hot, and all our brick walls were so low that actually everyone was talking, everyone was interacting for the first time in a whole year. And so I was just saying it was a really special, and I felt very lucky to be so accepted in an area where people had known each other for years, and we were the only odd one out on the street. Yeah. So it was a really special time for community, I thought.
Yeah, that's a lovely reflection. And interestingly, someone from one of the communities in Manchester fed back in an event we did a few months ago that they felt that the pandemic had moved people away from their individual communities. It was almost like becoming a neighbourhood where it was everyone in one space, not just sort of like groups. So yeah, lovely, thank you. Anyone else? There was a gentleman behind you, I think.
Would you like to forget? Or
Whichever you would like to share.
Actually, the thing I'd like to remember is when the epidemic hit, I'm a GP, as you might have gathered, and there was a sense of collective endeavour in the practice, which was really very powerful. Having to do new things very quickly, under a set of circumstances that you couldn't really work out the whole dimensions of it. And that was particularly focused on the early days of vaccination, when we in the NHS employees and also the elderly were gathered together in local clinics. And there was an amazing sense there of collective endeavour, even though it was in a slightly different context.
Yeah, lovely, thank you. And I know we need to, oh, the gentleman down there. Yeah, do shout, yes.
We were just saying that we don't learn from them.
So that comment was that there shouldn't be anything that we want to forget because we need to learn from them, so we do need to remember. Yeah, that's again, it's an interesting point for that. Yes. We've got time for just one quick question, if anybody's got anything else they'd like to add or ask.
What we do want to forget is the unnecessary deaths and
Yes.
the awful mistakes made with PPE and the wasted money on test and trace. We should learn from that.
Yeah, no, I think that's a good point to finish. Thank you very much. If you want to find out more about the project or share your story or sign up for our longer film premiere, you'll find all the details on our website, and they will also be in the slides that will be shared with you after the event. Thank you very much.